how do we communicate the tension that you just mentioned to a regular person who doesn't necessarily have epidemiological training and also have them not mistrust us?
It is within our role and our responsibility to make sometimes recommendations and sometimes policies and laws that
Yeah.
we think keep the population more safe. But I also think that we have to be quite humble when we're doing that on the spectrum between persuasion and coercion.
Yeah.
Persuasive being, I'm communicating to you, I don't think that you should smoke. I think smoking is bad for your health. Coercion being, I'm going to enact policies and laws that coerce you to do things like get your children vaccinated before they go to school. Across that entire spectrum from recommendation to policy and law, underlying it is the so-called evidence base. And I do think we have to be quite humble about the rigor of the evidence base. What we need to do in public health is endeavor to conduct the most rigorous studies and be very transparent with the public about the strengths and limitations of that evidence base, and do so always with an eye towards kind of what is the least invasive way that we can protect the public's health so that we, to the extent possible, preserve individual autonomy. I think where public health fails is when we underestimate the ability of the public to accept nuance.